Great. Well, thank you all so much for joining us this afternoon. It's a rainy afternoon in Baltimore, but we are excited that you've chosen to spend the time with us. Today, we have a really exciting session with the Maryland Department of Health. We have a number of different representatives, including some alums that will be speaking about their experience working for the state of Maryland. And so, with that, I want to turn it over to Catherine and Sandy, who are going to kick us off with a presentation.
You're bringing the slides up, Sandy? Excellent, she is. And do you want to start talking or just should I jump in?
You can go ahead and jump in.
Okay, spectacular. We'll introduce ourselves individually. So it is so great to be here with you today. I'm Catherine Feldman, Chief Public Health Scientist in the Office of the Deputy Secretary for Public Health Services. It's a mouthful, but I'm going to introduce you to the department so you'll better understand that. And then Sandy's going to follow and tell you all about how you can possibly join us here at the Department of Health. Next slide. So I'll start by introducing you to the department and all of the good work that we do at a very high level. And then I'll hand it over to Sandy, who will review opportunities and benefits and how to actually apply and work your way through that process so you can join us. Next slide, please. Next slide. Okay, so at the Maryland Department of Health, our vision is for lifelong health and wellness for all Marylanders. And so a few things to really highlight there, all Marylanders. We want to make sure we serve everyone in Maryland. And of course, we're trying to achieve health and wellness for all. And we do this by working together to promote and improve the health and safety of all Marylanders through the disease prevention, access to care, quality management, and community engagement. I'm sure many of those words, terms resonate with you, being in your public health education now, and we are all driving towards improved health outcomes. And one of the key things is advancing health equity. So we provide public health and healthcare services throughout state programs, local health departments, state-run hospitals and residential centers, and contracts with private sector healthcare providers. And I'll dig into that in just a little bit more granularity on the next slide. So I don't want to put everyone to sleep with an org chart, but I am going to run through a series of slides with our org chart. And I think it's really helpful to understand how we're organized, and I'll try to keep it conversational so it isn't just a lot of words in squares. Key point here is the Maryland Department of Health is an executive branch agency. So we report directly to our new governor, Governor Wes Moore, and our Secretary of Health, Dr. Herrera Scott. So we are an executive branch agency, means we work for the governor. We work in coordination with the legislation then, and of course with the judiciary. So if you think back to the three branches of government, we're in the executive branch. We're going to dig into more of these details on the next slide. So I first want to introduce you to our new Secretary of Health, Dr. Herrera Scott. A lot of Hopkins connections, so that's great. Dr. Herrera Scott comes to us with just incredible public health experience and perspective, as well as healthcare financing perspective. So we're just delighted she's now steering our ship. I had hoped to share a video of her encouraging you to join our workforce, but unfortunately we couldn't get the audio together. If I can figure out how to get a link to you, I will send that out afterwards. Next slide, please. So what I want to introduce you to now are the different units under Dr. Herrera Scott. And so I hope to provide some life to all of these. So again, they're not just words and squares. So Public Health Services. This is the administration in which I sit, where I've had my career at MDH housed, is in Public Health Services. So we have a new Deputy Secretary for Public Health Services, Dr. Kalyana Raman. He comes after having served in a local health department, so he brings that local perspective as well as a perspective coming from federally qualified health centers. So he's got a lot of great experiences that are now converging on serving the state of Maryland. This administration within MDH provides all of the traditional public health services, the 10 essential public health services, if you will, plus some. So we're responsible for outbreak investigations, pulling implicated products off of shelves if we identify, the source of an outbreak. We do things like rabies investigations and making sure that people get appropriate preventive therapies to prevent rabies. We provide environmental health services such as food inspections, well and septic system regulations. Women's health is a priority for our new secretary, and the maternal and child health program is housed in this administration. Also, diabetes and other chronic diseases, long COVID, cancer, these are all housed in our Cancer and Chronic Diseases Bureau in this administration. We have our public health laboratories, and one of our alums is in our laboratory, and one of the alums on the alumni panel. But our public health laboratory conducts lab testing for diseases and conditions of public health importance. And is often the first lab able to provide those services for newly emerging diseases. We also are responsible for preparedness and response, making sure we're ready for whatever comes next. Vital Records, the oldest public health surveillance system, is housed within Public Health Services. So registration of births and deaths, issuing birth and death certificates is all part of what we do. There's also some less usual but equally critical services within this administration. So our chief medical examiner is housed in this administration, and our Office of Healthcare Quality that ensures that licensed entities such as nursing homes are in compliance with regulations. So this is a huge, huge, huge administration. And in many states, this would be the entirety of the state health department. And the other things I'm going to talk about next would be in their own agencies. So in Maryland, we're a super agency. So next slide, please. Okay, next up is our Developmental Disabilities Administration. And this administration is guided by the principle that individuals with developmental disabilities have the right to direct their lives and services. And so this administration partners with individuals with developmental disabilities and their families and provides coordinated service delivery to enable individuals to live fulfilling lives. Next slide, please. Okay, another very important administration that often is its own agency in other states, our Behavioral Health Administration. This administration has oversight for publicly funded inpatient and community behavioral health services to help individuals with substance-related disorders, mental health disorders, co-occurring disorders, problem gambling disorders. So clearly, really important critical work that is done in this administration. They're also responsible for regulating and licensing all behavioral health programs in Maryland's public behavioral health system. And I just want to highlight this, new number for mental health, substance use, and suicide prevention support. You can call or text 988 if you're in need of any support in those areas. Next slide, please. Okay, so this is the Healthcare Financing and Medicaid Administration. So again, often a separate agency in other states. This is a huge administration that ensures that vulnerable Marylanders receive health care. So they administer many medical assistance programs, such as Maryland Children's Health Program, Maryland Healthy Smiles. And we have, I believe, Joe, who's one of our alums presented today, is within Medicaid. Okay, next slide, please. And then finally, our Operations Administration. And this really, this is the unit, the administration that keeps MDH running. So our procurement, our contract management, our facilities. Importantly, our Operations Administration also operates the MDH healthcare system, which is 11 facilities focusing on providing services to individuals with behavioral health conditions, chronic care conditions, and residential treatment for adolescents and individuals with developmental disabilities. So lots of important work done across MDH. Next slide, please. But we can't do this alone at MDH. Maryland is a big state, 6 million individuals, and so we work hand in glove with our boots on the ground, local health department partners and colleagues. So there are 24 local jurisdictions in Maryland, each with its own local health department, And those are the folks who really know their communities. They're out there in their communities. They're providing services, making sure that people have access to healthcare and other public health needs. And I think Rita is here and can represent local health departments. But really, the work that is done for public health in Maryland is a coordinated effort between MDH and the local health department. So really critical to understand that it requires this entire public health ecosystem to ensure the public health of Maryland. Okay, and then I just want to finish up, next slide, by mentioning the boards and commissions. So all of the licensing boards for the health professions other than veterinary medicine, I'm a veterinarian and I know that's not housed here, but otherwise they're all boards, licensing boards affiliated with MDH. And then there are many, many commissions as well. A couple important ones to call out. The Health Services Cost Review Commission is Maryland's hospital rate setting authority. And then the Healthcare Commission is an independent regulatory authority that plans for health system needs and works to improve access. So I just want to finish up on a couple of notes about some social media. So next slide, please. We have some tremendous videos. I'll have to send you this link afterwards, but you can hit this link for our MDH National Public Health Week 2023 YouTube playlist and meet many people across the public health ecosystem who are working hard every day on behalf of Maryland residents. And so I want to make sure you have access to this link. Videos are short to watch, but they are very moving and inspirational. And I'll end with the next slide, just directing you to follow MDH on social media, and this is how you can do it. We'll make sure you get all this information. And over to you, Sandy.
All right, thank you, Catherine. Thank you for that overview of Maryland Department of Health. I'm Sandy English. I am Deputy Chief of Recruitment Outreach, and I'm going to talk to you about the different types of jobs, career paths, how to apply, and things of that nature. So we have different types of positions under us. We have our merit or permanent positions. We have contractual positions, our at-will, which are special appointment or management service positions, internships, and then what we call TE or temporary emergency employment. So these are just different statuses of employment with Maryland Department of Health. So these are the types of appointments that you'll see listed as you look at the different positions we have available. So some of the different public health career paths that are available to you are community health educator. The entry level for that is starting at the 1. We have our community health nurses, our coordinator of special programs, which has 4 different areas in which we of emphasis, which are addictions, developmental disabilities, health services, and mental health. We have our registered dietitians and nutritionists, our epidemiology track, and our environmental health specialists and sanitarians. And just to give you a brief overview of each of those, our community health educators, they require that you have at least a bachelor's degree in public health education, community health education, or health science. And they're responsible for planning, developing, implementing, and promoting health education projects designed to further public awareness and understanding of different factors that influence health status and community health activities. We have our community health nurses, which are primarily in the local health departments. They function in different ways through our clinics, through vaccine clinics, through as school health nurses, and our coordinator special programs. They're responsible for coordinating programs as they relate to, again, addictions, developmental disabilities, health services, and mental health. And that requires at least a bachelor's degree in nursing, social work, psychology, education, counseling, or any of the related health services, health sciences, or health services. Dietitians, nutritionists, to start with that, you would be required to possess a license as a registered dietitian or nutritionist. And then for our epidemiologists, again, the 1 being the entry level, requires that you have your MPH in epidemiology with 3 graduate courses in epidemiology and at least 1 graduate course in biostatistics. And then the environmental health specialist, that will require licensure as an environmental health specialist. But those positions are primarily responsible. located in our local health departments. The environmental health specialists and the sanitarians are located in our headquarters. They're responsible for inspections and investigations, ensuring the compliance with environmental health laws and regulations. And now on to some more of our public health career paths. So we also have health policy analysts, with the health policy analyst associate being the entry level to that. And as a health policy analyst, you of course will be evaluating, analyzing, researching, and developing healthcare services, policies, and programs within the Maryland Department of Health. We have our program administrator, which is much like the coordinator in that it focuses on addictions, developmental disabilities, health services, and mental health. As a program administrator, you direct major programmatic activities, units, providing health services to those specific populations. We have our public health laboratory scientists, and the one being the entry level to that, all the way up to a lead or advanced level. And then we also have public health lab scientists, developmental, and supervisory levels. With the public health laboratory scientists, that of course will require that you have a bachelor's degree, at least in biochemistry, biology, biotechnology, chemistry, genetics, immunology, microbiology, molecular biology, medical technology, pharmacy, or zoology. And then your work would be performing analytical, diagnostic, environmental, and epidemiological laboratory testing in our labs. We have our registered nurses, which we have several different levels of registered nurse. We have our psychiatric, medical, registered nurse, and medical. And then with each of those, we have the different options of charge, supervisor. As a registered nurse, you will be located in one of our facilities, state-run hospitals or facilities. And then we have our social worker. Our social worker one is the entry-level master's. You would have to have your license as a master's level social worker. And then we also have our court-involved social worker. The social worker one, court-involved, is located in our forensic psychiatric unit. And then some additional career paths outside of the typical public health paths. We have our more operational accountants, administrative officers, administrators, which also you may find some of the public health positions under the title of administrative officer or administrator as well. We have our agency budget specialist, grant specialist. We have our IT positions like our computer information services specialist, database specialist, IT functional analyst. We have direct care assistants. So if you were just starting out in a nursing program and you were looking to do something, you can start off as a direct care assistant. We have fiscal accounts, clerks, and technicians, our office clerical positions, and then our office secretaries. So the benefits of working for MDH. We offer a variety of benefits to our employees. We have, under our health benefits, you have vision, prescription, dental, mental health, substance abuse, term life insurance, personal accident and dismemberment insurance. You have flexible spending accounts for your health care and for child care. And then there's long-term care. You were put into the state retirement plan. And then we have a generous leave offerings. So we have 12 regular holidays, 13 during election years. You start off with 6 personal days. You get 6 personal days each year. And then your annual leave is earned at a rate of 10 annual days per year, and that increases with your length of service. And then sick leave you'll earn at a rate of 15 days per year. And you have paid parental leave, again, through the flexible spending account, the reduced child and healthcare costs, student loan forgiveness programs, and then there's student loan repayment programs for hard to fill and hard to retain classifications. with flexible work schedules, and that's contingent upon the type of work that you're doing. Because if you're in a facility, if you're doing some sort of clinical work, then that it may not necessarily be as flexible. But we also offer free mass transit within the Baltimore metropolitan area. And then contractual employees are also eligible to earn limited leave benefits and healthcare coverage. Okay, the application and recruitment process. How do I apply? So now that you've learned about all these different positions and maybe something's piqued your interest, you want to know how you can submit your application with us. So in order to apply, first off, you can visit our website here, jobappscloud.com/MD. That is our jobs page. If you go to our main page, which is the health.maryland.gov, that's where you can find out all the information that Catherine was speaking on, but you can also, it'll also link you to our jobs page. So I'm going to take you to our jobs page, and there we'll go over the different types of job postings that you'll see, which are like regular active recruitments, our contractual, regular ongoing recruitments, contractual recruitments, and so just learn the different types of postings that are there. Okay, so this is our website. And here you'll see our current recruitments, ongoing recruitments, and contractual recruitments. So our current recruitments are all of our merit or permanent positions, including also our management service positions will be listed here as well, if they are permanent. So you'll see I have all this listed. And as you scroll down, then you'll come down to our contractual listings as well. And our ongoing recruitments. Our ongoing recruitments are positions that may not have a closing date or they have an extended closing date. So ongoing, you can apply for it any time. They're positions that we hire for regularly, or positions that we fill quite often. So there may not be a closing date. So if there's something where you're in the process of getting a license, you're not ready to apply yet, for example, a registered nurse, then that position will be there for you to apply once you get your license. Within our contractual recruitments, contractual positions are typically 6 months to a year, with the potential to renew that contract. So this just gives you an idea of what our website looks like. And then I'll go back to that slideshow. On our website, you'll also find a feature called interest cards. The interest cards will allow you to track different positions. So for example, if you're interested in, you want to apply only to epidemiology listings. If you go to the interest cards, it'll give you several different job categories. And with those job categories, you select the ones you're interested in. So you may select master's degree, or you may select health, mental health, or public health. So you'll make your selections. It'll give you a list of different positions that fall into those categories. And once you see that list, and it'll be a very long list, you can go through and review with the class specifications, which give you just a generic overview of what the positions typically entail, as well as their basic requirements. Again, this is just a generic description. It's not specific to an opening that we have, but it just gives you an overall idea of what that position does within the Maryland Department of Health or within the state. So once you make your selections, it will prompt you to put in your email address. And then once you put in your email address, you can start receiving those alerts. You'll receive them for 6 months. After 6 months, you'll have to renew those alerts. Okay. So then after you've viewed the interest cards, maybe if you don't have an account, you'll want to create an account. So you'll go and create an account by setting up an application template. So this link here takes you to the application template. If you click apply, this is where it'll give you all the instructions for setting up that application template, which will allow you also to set up your account. Once you've set up this account, you can then, once you set up your account, you can then start applying for different positions. So you can copy your application. When you've copied your application, you can create an application for one position and you can copy that for other positions. So you don't have to keep putting in that same information. The only information that you'd have to put in over and over again is your profile. So your profile will ask, it's just like your basic information, like how did you find out about the position? It'll ask you if you've had employment with the state before. So it'll ask you a couple of different things. It'll maybe ask about your address as well. So the profile, you'll have to fill that in again, but your information for all of your experience and your education, you won't have to fill that out. So understanding the job announcement. So there are several different parts of the job announcement, and I'm going to take you to one right now. Here's an example of one we have open for an epidemiologist 1. You'll find the job title here at the top. Sometimes you'll also find the working title. So what you see here is the classification. Sometimes it's just a classification, but if it's a working title, that's give you a more descriptive title for that role. You'll see the department where that position is located, the date the position's open, and the filing deadline. Make sure you pay attention to that filing deadline. That's when you need to submit your application. You'll see the salary. This is for a contractual role. So as you see, the salary is put down here as an hourly rate. Employment type, it is full-time. You'll see the name of the HR analyst. This is the person that is reviewing the applications. This is not the hiring manager. And then you'll see the work location. Here, this position is located in Baltimore City. As you scroll down, you'll come to the grade of that position. So that tells you the salary scale, the grade on the salary scale. Again, the location, this will give you a more descriptive idea of where the position is located. It may go as far as into which unit it's located in. This position is within the Prevention and Health Promotion Administration within the Division of Outbreak Investigation. You'll also come down to the main purpose here, which again will describe that position. The minimum qualifications, which are broken down by education and experience. Sometimes you'll also see notes here. A lot of times in the notes, you'll see substitutions. Here, this is a substitution for those who have served in the military, but you'll usually see substitutions as well for education or experience. So for example, a position may require that you have 8 years of experience, but the substitution may indicate that you could use your master's degree for 2 years of that experience. So also pay attention to those notes when you see because there may be a substitution that applies to you. Some positions will have desired or preferred qualifications. So as you see here, this position has a desirable qualification. A desired qualification is something that the hiring manager is looking for on top of the minimum qualifications. It's not that it's, you don't have to have it, but it's something that their preferred or desired candidate would possess, what their ideal candidate looks like. Another type of qualification that you'll sometimes see is a selective qualification. The selective qualification is required in addition to the minimum qualifications. So when you see a selective qualification, you must possess the minimum qualifications and the selective qualification. If you do not have the selective qualifications, then you will not qualify for the position. Unlike the desired or preferred qualification, if you don't have it, you may still qualify. You may just not be considered the best qualified candidate depending on the role. As you come down here to the selection process, this just gives you some general information on the process. Talks about meeting the minimum qualifications and selective qualifications, the type of evaluation that is done when reviewing your applications, just reiterating the importance of putting all of your information on your application as it relates to your education experience, dates that you've worked and hours that you've worked, as well as any information pertaining to foreign education. It also talks about the closing date, submitting your application by the closing date. Your complete application must be in by the closing date. You may not make changes to your application once you've submitted it. We only accept applications through the Job App system, application forms through that system. We do have a paper application available. That is the application that we have for paper applications. If you have to use that for some reason, there's some sort of difficulty in submitting the online application, that link is all the way at the bottom here for you to print out the paper application. When you submit a paper application, you must also print out the supplemental questionnaire and submit it with your paper application. But these are the only acceptable applications, this paper application here and the application through the online system. There's also a message here about the period of eligibility for your application. Once you've submitted your application and it has been approved, you'll remain on the eligible list for 1 year. So during that 1 year time, you could be reviewed more than once for multiple positions, for similar positions. So if you applied for this epidemiologist one and you weren't selected, there may be another epidemiologist one that comes open that you may be considered for. Down here, we talk about the benefits. So again, this is a contractual position. So it goes into detail about the benefits available for contractual employees. For permanent positions, you'll find a link that takes you to all of the benefits that I had mentioned in the previous slide. And then further instructions. Again, it talks about where to submit your paper application if you are submitting one. Paper applications must be received by 5 p.m. On the closing date. No postmarks are accepted if you're using a paper application. Again, if you need to submit any additional information like a transcript or cover letter or resume or whatever it is that you want to submit, you can upload those and attach them to your application if those things are enabled for you to do so. Or if you can fax that to the number that's listed here. If you have any questions as you're going through your application or about the recruitment process, the number here takes you to our office. If you have any issues with the actual application in the system, then you can call this number here for the Maryland Department of Budget and Management. There's a phone number and email address there for you to get assistance. For individuals with disabilities, there's information here as well for like relay service. And then, of course, we encourage veterans, bilingual candidates, and individuals with disabilities to apply. We have all kinds of positions available, and we're also able to make several different accommodations, of course. So that is just an overview of the job announcement and things to look at as you're looking at these different job announcements. So the recruitment process. So our positions typically stay posted for 2 weeks, and they may stay a little bit longer. You may see some posted for a month, but they have to stay posted for at least 2 weeks. We allow up to 3 weeks from the closing date for the review of applications. By the end of the 3 weeks, an eligible list is created and given to the hiring manager. An approval and disqualification notices will go out for our permanent positions. So please allow at least this amount of much time in order to hear back regarding a permanent position that you've applied for. From that point on, once we've given the eligible list to the hiring manager, then the hiring manager is responsible for setting up interviews and contacting candidates in terms of interviews and making selections. If the position is open and continuous, again, it does not close. You can submit your application at any time. So this timeline here of the 2 weeks does not apply. And also the waiting for 3 weeks from the closing date does not apply. Applications are reviewed periodically or as the eligible list is requested. So with the open and continuous list, if you submit an application there, you're being considered for positions as hiring managers request to utilize that list. Again, you'll remain on an eligible list for a period of 1 year. And during that time, you could be considered for multiple vacancies of the same classification, or you may even be considered for vacancies through other state agencies, not just Maryland Department of Health in some instances. So now I'm going to go over some tips for applying, some do's and don'ts. Some of these things may seem like common sense, but they are things that we've run into a lot as we review hundreds and hundreds of applications. So these are just some things just to remember as you're completing your application. Read carefully, make sure you comprehend what you're reading, take the time out to review your application and create your responses. Try not to rush through it. Again, just reminding you that desirable qualifications are preferred but not required, but it helps to determine the best qualified candidate. Selective qualifications are required in addition to the minimum qualifications. So just making sure that you highlight any experience that you have on your application as it relates to those desirable and selective qualifications. You want that information to stand out so that our recruitment analysts can pick up on that information as they're reviewing your application. Most of our positions that are posted have a supplemental questionnaire. You must submit it even with paper applications. So the supplemental questionnaires will typically ask you questions regarding the desirable qualifications or selective qualifications, sometimes licensing, sometimes education if it's a position that requires that you have a certain number of credits. Please complete that supplemental questionnaire. Please do not copy and paste information off of your application when it comes to those questions. The supplemental questionnaire is your chance to expand upon that experience. So if you're talking about those desirable qualifications, that's your chance to go a little bit further into explaining that experience that you have. It's important to keep electronic copies of your transcripts, both undergraduate and graduate, on file in the event that you need to submit a copy. A lot of times we do ask for a copy. You just submit an unofficial copy, it's fine. Keep updated copies of your certifications or documentation of your certifications. A verification page is fine. I know for some positions that require a license, some of the boards don't give people copies of their licenses anymore. So as long as we have that license number, then that would suffice. Again, carefully read through your whole application once you've completed it. Look for errors. Just make sure everything makes sense and that it's complete. It's even a good idea to have someone else read your application before submitting it, especially if it's your first time submitting something to us. It's always nice to have another pair of eyes to look for errors on your work. Again, use spell check. Answer all of the questions on the supplemental questionnaire. If the question does not apply to you, put NA. Don't put something else there. Do not put C resume on any part of your application. A lot of times people will put C resume and then they don't attach their resume, or their resume is not formatted in a way that it gives us all the information that we need. Do not copy and paste your resume to answer supplemental questions. Again, use that supplemental questionnaire to expand upon your experience, to highlight that experience better than just the bullet points that you had on your resume. Include all of your dates of employment and hours worked. So on the application, you'll see it as a space for the dates that you worked in those positions. Make sure that you complete that, because when we're reviewing your application, if a position requires you to have 3 years of experience and we're looking for that 3 years of experience, we are actually calculating that experience. So we're looking for that information. So if you work somewhere part-time, for example, you work somewhere 20 hours per week for 1 year, that will count as 6 months, not 1 year. So please put your complete dates of employment and hours worked. Also be consistent. Make sure that whatever you put on your application is consistent, especially as you go down into that supplemental questionnaire. Sometimes people will list jobs on their application, but then come down to the supplemental questionnaire and reference something that wasn't even on the application. And we don't have a way to go back and give credit for it because we don't know how long you were there, but you mentioned it. If you attended a foreign university, please submit a foreign credential evaluation if it's something that you need to qualify for the position. A company that we recommend to go through is the National Association for Credential Evaluation Services. The members of that organization are accredited companies that offer foreign credential evaluations. So typically we accept evaluations from members of NACES. And then just some important links here. So our MDH homepage is at health.maryland.gov. Our job postings can be found at thejobscloud.com or //MD. The class specifications, which you can also access through interest cards. Again, that's just a generic overview, a general overview of what the position does and its requirements. And then we have a link to explain the benefits, as well as a link to NACES that lists all of the different members. If you have any questions, I can take those right now. So I see some questions in the chat box. So I see someone asking, someone says, I am an international MPH candidate with 3 years STEM OPT, which allows US legal authorization to work in the US. May I know if the opportunity at MDH is open to international candidates like me in Baltimore? So we do accept any position where we don't have to do sponsorship. However, if it's a permanent position, all of this is reviewed on a case-by-case basis. I know it works out well for internships and contractual positions, but if it's a permanent position, there may be some obstacles there just because it's only limited to a certain number of years. But these are, as far as OPT and things like OPT and CPT, that's reviewed on a case-by-case basis, and your contract would have to end once that authorization expires. So you are eligible to apply, just your employment would have to end when your authorization ends. And that was another question about OPT. Do we have any remote opportunities? We do have some remote opportunities. A lot of our positions are currently hybrid. As far as fully remote opportunities, we have a few. I don't think we have many that are advertised as fully remote, but you would have to look at that announcement to see if it is. So there should be a section on there or some sort of phrasing in the on the announcement letting you know if it's fully remote. This is MPH candidates are eligible or must be graduated. So if the position that you're applying for requires the MPH in order for you to qualify for it, you can start applying probably like a few months before graduation. I would say about 2 months before graduation, you could put your application in, and then we could place you on the list depending on where we are in the recruitment process. If you apply and you still haven't graduated yet, then we can place you on the eligible list as pending education, but you must have completed that degree prior to starting the position. So just on your application, if you haven't graduated yet or haven't earned your degree yet, make sure you indicate your graduation date on the education section. So where it asks for you to list your education, put the date that you're expected to graduate. If you leave it open, then we can't give you credit for that. And C, do you offer any assistance, support for those with a disability applying for positions? There are there is assistance available. And I know I did mention the phone number that's listed on the application. So that's one way in which you can get assistance. But if there is something else that you need to explain a little bit further, you can also, send me a message and we can discuss that.
Great. Thanks, Sandy. This is Erin Peniston. Hi, everybody. It seems like this would be a great time to transition to the alumni panel. I think you made it through most of the questions. And then certainly, if there's any time at the end, we could take some more questions at the end. Sound good, Sandy?
Yes, that sounds good.
Great. Well, with that, we're really excited. And Caroline, feel free to jump in here if you had anything teed up for this. I don't know that we fully did, but do you want to introduce the alumni folks or just jump right in?
Sure, I think we can just go ahead and jump right in if you're ready. I don't know if you all had worked out an order in which you want to start. I know we have Joseph on the call. Maybe Joseph, if you want to start us off, that would be great.
Sure. Yeah, thanks for having me. I am Joseph Walburn. I work with Medicaid, Medicaid provider services specifically. And I've been here with the health department since 2015, so about 8 years now. I actually started out as part of my field placement for MSPH and health policy at Hopkins. So some of you may be in a similar position. So to kind of tie it back to Sandy's presentation, primarily with the team I work on, we hire health policy analysts, which is actually where I started all those years ago as a contractual health policy analyst, and worked my way to where I'm currently, which is I'm a program integration manager for one of our IT systems that we use for our Medicaid waivers. So a big part of my job now is I oversee our team of people that do claims review for a lot of our providers that bill for the Medicaid waivers. And that involves some IT system oversight. So working with our vendors and their contracts, as well as working with them to design system functionalities that we can meet the needs of the specific business users that our system works with. And also doing a lot of work with program and policy and implementation. So with my job, I don't do quite so much policy creation and development. A lot of the work I do is more along the lines of taking policies that are being established and our IT system functionality and working with the providers and other people that are impacted to make sure that they have all of their needs met, that they understand everything they need to in order for us to successfully roll out whatever project we are implementing. So it's a little bit on my background. My day-to-day work spans a lot of different activities. I think one of the best things that I've gotten out of working this job is I've had my hands in a pretty big variety of activities. I started out, like I said, as a health policy analyst. Pretty soon after that, was managing a grant for a few years from CMS, and then eventually ended up in my current position, where it's interesting in a management role in terms of day-to-day. It ends up being a lot of meetings, which I'm sure plenty of people can relate to. But a lot of my work revolves around directing resources and doing a lot of planning for projects that we implement, some of which span years. I have a project that we launched a few years ago that was like the culmination of 7+ years of work. And so there's a lot of emphasis on communications in my role. So I do a lot of work in planning the rollouts for projects. So one example is right now I am working with a group of providers where we're implementing a new billing system to meet some CMS requirements for home health providers. So people who, like the name says, go into people's homes and do assistance with activities with Medicaid recipients. And so a big part of that is outreach and coordinating with providers. It's developing trainings, doing a lot of speaking with them and making sure that they feel comfortable and taking their concerns and trying to be responsive as much as possible. And so with that work, it's an interesting place to be in because I stand between a lot of our Medicaid waiver program teams who are trying to implement a policy and the stakeholders who are impacted by it, and trying to make sure that both can be satisfied and meet all of their collective needs, hopefully without somebody writing the governor or something like that, which is worst case scenario. I'm trying to think through, is there anything else? I would say my work today is, like I said, there's a lot of different things you have your hands in, and there's, I would say, always a problem to solve. I think that's one of the more interesting things. I don't think the day-to-day is always quite the same. I work with a pretty big IT system with a lot of stakeholders. So we manage services for upwards of 40,000 clients or Medicaid recipients, hundreds of millions of dollars in payment, 700+ providers. And so it's a lot of people to be beholden to and to make sure that they understand what they need to do and how to use our system and what the impact of our projects are going to be. And so I think, one of the maybe most satisfying things in terms of our impact and the role that we play, although we largely work internally and with our provider stakeholders, when it comes down to it, the work that we do is pretty important in making sure that the actual Medicaid recipients get continuity for the services they're supposed to receive. If providers aren't getting paid because of our system, or if our system isn't working for whatever stakeholder, whether it's a local health department or another arm of MDH, if the system isn't working for the tasks that they need to complete to make sure that people are enrolled and that they're authorized for whatever services they're supposed to receive, those people are not getting the care that they need. And so their health and safety needs are not being met. And we're not meeting the goal of the waiver, which is largely for the waivers I work with to keep people with special needs. So elderly and disabled individuals, for example, to allow them to have a higher quality of life by living in the community as opposed to being in an institution like a nursing home. So it's a really vulnerable group, the one that's really important that we take care of. And then I think just on the more financial end, we play a big role in fraud, waste, and abuse detection and prevention. And so that's a pretty great impact to have as a taxpayer in the state. And I'm sure other taxpayers appreciate making sure that our money is being used appropriately. And yeah, I think that is generally a summary of kind of what I do and where I work. Is there anything you want me to add?
I think that's really helpful, Joseph. Thank you. I know Beth Resnick is on the call and is excited to see the MSPH HPM program represented. So thank you very much for stepping in and doing that. I guess we'll hold off on questions maybe until all the panelists have had the opportunity to share a little bit about their backgrounds. So I'll just move in the order on my screen. So next would be Lior, and then we'll have Rita share their experience.
Great. Hi, everyone. So my name is Lior Klein. I am an MSPH grad from PopFam. So if any PopFam folks are around, hello, very excited to have you. So I graduated in 2016, and I have been with MDH since 2018. I am kind of unusual in my role in that I am an epidemiologist who, instead of being placed in the Prevention Health Promotion Administration, is based out of the Public Health Lab, so the Maryland Department of Health Laboratories Administration. So my main role is to do the day-to-day coordination and non-scientific program management for a multi-state antibiotic resistance surveillance program called the Antibiotic Resistance Laboratory Network. So mainly we deal with superbugs, super fun. We focus on Candida auris, carbapenem-resistant enterobacteriales, and other healthcare-associated infections. We also do some work in azole-resistant Aspergillus fumigatus, which can be healthcare associated, can be environmentally associated. And we also get to work on drug-resistant Neisseria gonorrhea infections, which is a great way to tie in my experience in PopFam, since my master's was in sexual and reproductive health. So the day-to-day work of my job is a little bit logistics, a little bit grant management, a little bit applied epi. So I so not only do we provide testing and kind of epi consults for Maryland-based healthcare-associated infection investigations, but also I serve as a regional epidemiologist to consult on epi investigations from Pennsylvania through South Carolina, and we have a little bit of a kind of national or semi-national scope for some of our other testing programs. So I do a lot of gatekeeping for the testing that happens at the State Public Health Lab. So a lot of our testing, it's not something that you can just kind of go to your doctor's office and ask for. It's highly specialized and therefore needs to be approved by the State Public Health Lab in advance. So I do a lot of that gatekeeping, and I also do a lot of grants management for the laboratory specific contributions to the epidemiology and laboratory capacity grant. It's a long-standing source of funding. It's one of the most kind of stable sources of funding over the last 20 years from CDC that provides a lot of kind of broad-based infectious disease funding for all manner of different programs. So I think one thing that's really meaningful, impactful about the work that we do, we're not only able to kind of influence work that's directly affecting Maryland residents, but a lot of our work has national or international importance. Our work with Neisseria gonorrhea directly influences the treatment recommendations for Neisseria gonorrhea. So we do antibiotic susceptibility testing, and those results feed into a national database that helps CDC make decisions as to what drugs they should say should be used to treat Neisseria gonorrhea. And so when those results change, when those drugs change, it's because of the testing that the gonococcal isolate surveillance program does throughout the country. So I think it's really amazing to be a part of that. And also, I think a lot of healthcare associated infections really affect our most vulnerable Marylanders and our most vulnerable residents throughout the country. So, when we're looking at multi-drug resistant organisms, it's mainly affecting, severely medically fragile, severely immunocompromised individuals, a lot of folks with chronic vents, chronic trachs, a lot of indwelling devices, and those residing in nursing homes and long-term care facilities. And so being able to really do a lot of containment and response and surveillance for these multi-drug resistant organisms, and making sure that, people who are coming into these healthcare facilities to receive the care that they need aren't leaving or going somewhere else with more conditions than they came in with. So it's a really fun and interesting program. And as I've kind of been in this role, it's kind of grown and shifted in some really cool and interesting ways. And it's been really fun. So I don't know if there's anything else I can add.
That's great. Thank you, Lior. Sounds like you're doing some really interesting work. And last but not least, we have Rita.
Thanks so much for having me. Good afternoon, everyone. I'm Rita Dang, Senior Planning Specialist at Montgomery County Department of Health and Human Services within Public Health Services. And I provide data-driven technical assistance for the county's community health improvement process called Healthy Montgomery, which also includes the community health needs assessment, which is really also one of the cornerstones for an accredited public health agency, a local health agency, where there are many standards and measures directly attributed to community health needs assessment, as well as community health improvement. Montgomery County is one of the largest counties in the state of Maryland, and so we have over 1 million people. It is where I grew up, so it's truly rewarding and fulfilling, in my view, to really serve the community that really helped me grow. And so it's just been incredibly rewarding. And I've been in this role for 5+ years, almost 6 years now as of September of this year. And a lot of the activities that I engage in from day to day is really data analysis, using a lot of the vital statistics data, specifically birth data, death data, hospitalization data from vital statistics, as Dr. Feldman had mentioned, which is really our bread and butter, to calculate age-adjusted rates and look at the disease burden in terms of public health and population health, and really lay those out in meaningful report formats or responding to data requests from county council, as well as other stakeholders that are engaged in the community health improvement process, whether that's local nonprofits or someone like Banner Health Center, Primary Care Coalition, or private stakeholders that have a state interest, like the local hospitals. There's 6 local hospitals within the county, to really answer a lot of their data-driven questions and also make recommendations on existing policies and programs. So one of the ways that we really have supported the health of Marylanders in general is that we actually have received a grant from CHRC, and that is the Community Health Resource Commission within Maryland Department of Health, where we actually did innovative work sharing data with local fire and rescue to pull 911 data of repeat callers of those living with diabetes, and actually adding on community health workers within our team to reach out to those folks by applying sort of the state-of-the-art CDC current model in order to prevent repeat calls. And so that's been a grant that's coming out of CHRC that we've been working on for 2+ years. And we actually are submitting an abstract to the American Public Health Association as a result of this work, where it was clear and it was statistically significant that we clearly had a reduction of really secondary prevention in reducing the repeat calling rates for those living with type 2 diabetes. And another project that I'm very proud of is, since being here at the local health department, we've actually successfully applied for a Robert Wood Johnson Foundation grant that was really part of the All In Health Network, where we really advocated and empowered local communities to think about data sharing, and led to community-based data equity work groups, where we not only presented what data there is available, but also really held community conversations and focus focus groups where everybody came to the table to better understand what is available and what is further needed in terms of local data collection. And that had since given us more resources and opportunities to advocate for local data collection. In fact, we've just recently released within the county the first ever primary data collection that's linked to the most recent version of the community health needs assessment, a comprehensive set of health survey questions where we actually partnered with a local research survey company to field out of 9,000 residents oversampling for minorities to really ask for their perceptions of health and also just overall of community health, including some questions on how they've been impacted by the pandemic, and gotten back actually, over 1,300 responses, and have analyzed that locally and sort of looked at disparities both in ways of socioeconomic status as well as, areas of grading equity in order to address some of the pertinent issues related to community health improvement. So there's still a lot to be done, but I'm glad to be part of this process in sort of moving slowly, moving the needle in the right direction. So I'll stop there and just entertain any additional questions that anyone might have with the panel together. Thank you.
Awesome. Thank you so much, Rita. Thank you, Joseph, Lior, and Rita for sharing your experiences. It was very helpful to hear about the different work that you're doing. And so with that, I think we are going to open it up for some Q&A. Is that correct, Erin, or do we have something else before that?
Yeah, I think it's a great opportunity now with a little bit more time to talk with folks. And thank you all so much, panelists. Really re-energized me to hear all the wonderful work you're doing state and locally in support of public health.
Great. So with that, I will invite students to submit questions in the chat. I'm more than happy to read them out to either the panelists, or if you have questions for the other MDH staff, happy to do that. Well, I'm happy to kick things off with a more general question to our panelists. Just curious, Joseph, Lior, Rita, what attracted you to the Maryland Department of Health, and what has kept you working there?
I can start out. So I think what attracted me the most is when I was in my program at Hopkins. Like I said, I was looking for a field placement, which some of you may know is a very stressful time. And I think I was a little bit lost in terms of my long-term goals. I was, maybe lost isn't the best word for it, but I was kind of in a, I'm willing to try anything phase. I just want to get out there and get some experience and see what the world of working in public health has to offer. And so when I started here, I think that's what drew me in, because it sounded like I would have that opportunity, and it did end up being true, to get my hands in a lot of different areas. I've done budget work and grants management, like I said, managing people and stakeholders. I've worked with several different Medicaid programs and being able to understand their waivers and requirements. I've done regulation writing. I feel like I've really gotten a great idea of a lot of different aspects and keeping some of these government programs running. And I've really built out my understanding of policies, especially as it relates to our waiver programs and all the underlying work that keeps them running on a day-to-day basis.
I'm happy to go next. So I think that, I was initially, really attracted to work at MDH, for when I had started my public health career as a community health educator in these nonprofit jobs where it was grant funded for a year, and every year you're wondering if you still have a job, and it's all very stressful. And it was really exciting to just like have a job that was funded because you're in a state that really invests in public health, and there's, you know, these kind of longer running federal sources of funding that allow you to really grow within a role and not constantly be scrambling and thinking like, what else can I really accomplish if I'm going to be gone in 6 months? So I think that's been really exciting. And just being able to, you know, it is a state government job, but I get to have such a wonderful kind of collegial relationship with CDC, with different public health departments. The fact that our work is a little bit more expansive beyond Maryland allows me to kind of scratch the itch of, you know, wanting to do kind of more expansive national based work, but still being within a state and feeling like I can really see what I do on a state level. And also on a personal level, the benefits of working for a state government as a parent of 2 young children are really fantastic. And, you know, the paid parental leave for folks who come from other countries where, you know, paid parental leave in America is just terrible anyway, but we really do have really fantastic parental leave, and for gestational parents and non-gestational parents. And I have taken advantage of it in both instances. And so it's really, I think, a really wonderful thing to have, and having the flexibility to, you know, be a parent of 2 young children and still have a very demanding and interesting and exciting job, I think has been really wonderful. So that's what's kept me here.
So I will say that I'm being hired as a county employee. So my direct employer is actually Montgomery County government. Although we work in tandem and very closely with Maryland Department of Health and are very intentional to make sure that all of the guidelines, for example, you know, the Vital Statistics Annual Statistical Report is really sort of our Bible every year, if you will, where we look onto data and make sure that the data is consistent, specifically the denominators in calculating, you know, age-adjusted rates for the population, and making sure that matches up with what's in the census is sort of really consistent over time. And, you know, county government surely have its own bureaucracies, but I will say that you'll be surprised with the level of creativity and innovation that is currently going on. And having been through a number of jobs in the DC area, you know, I've worked for National Academies of Medicine, worked for Henry Jackson Foundation. I will say that, you know, being at local government is truly really an opportunity in a lifetime where you have access to local data and you can actually work and talk to folks in the community, in your neighborhood, in neighboring jurisdictions, to, you know, try to come up with solutions together while feeling empowered by the data that you've sort of worked together to get and also sort of look at. And so it's really more of a solution-based sort of opportunity where you have also plenty to really think about in terms of, you know, now that Healthy People have come up with the 2030 measures that touches on social determinants of health. So there's plenty of opportunities in terms of data sharing, whether that's with fire and rescue, or whether that's with the police to look at crimes over time, or whether that's, you know, fatal crashes in sort of achieving Vision Zero. So there's so many, I think, spectrums and opportunities that are out there, especially related to all of these themes that are coming up in terms of health equity, et cetera, that is sort of unmatched, if you will, with all of the other opportunities, whether that's short-term contracting or you know, consulting and, you know, nonprofit and et cetera. So.
Great. Thank you all. Looks like we have a couple of questions in the chat, so I will go ahead and read them out. The first one is from William. William, I'm sorry, I didn't see your question from earlier, but I'm going to read that now. So this is directed to Sandy and team. Are you aware of any upcoming or future senior staff health policy openings on your Medicaid administration office, primary care program, or any other DHMH front office? William says he's particularly focused on the 1115 waiver programs that are equity focused and or addressing health related social needs. He currently assists North Carolina with our innovative health related social needs 1115 waiver program.
Hello, I actually I saw the question and I messaged William directly, but
Oh,
no,
good.
I do not we don't know of any upcoming roles, but we do have quite a few health policy analysts advanced roles that open up within that program. Um, so those interest cards that I mentioned before would be a good way to um keep up with those openings once they're, so that way you don't have to constantly check back to the website. So if you subscribe to the interest cards, and if you're looking for a more senior role, put in that health policy analyst advanced, then that's one way to keep track of those. But yes, I did reach out to William. Thank you for your question.
Okay, great. And then there was another question from Lisa in the chat. How to personally navigate political changes / financial changes working for a state department of public health. So I think anyone from MDH can chime in here with their perspective.
I'm happy to start. I think a lot of times people think like state government means that you are kind of buffeted by the winds of political change all the time, but I've found that a lot of my work is actually quite sheltered from political changes. We don't really, I think that the work that we do is kind of a very, very neutral good. And so, and it isn't really kind of affected by kind of political conflict in ways that, I mean, my background's in sexual and reproductive health, so I'm used to like protesters at my workplace. So, that's kind of my initial feelings, or my standard for what's kind of going to be conflictual. But I think that this is a state that really invests a lot in public health and has a lot of really strong relationships between kind of government and public health. So I work with a lot of healthcare associated infections groups in lots of different states around the country, and I'd say that Maryland is really quite lucky in terms of the real investment we have all the way up at the executive branch for kind of the commitment to public health.
I can add to that a bit. I think I have experienced what we always talked about in terms of being isolated, but also had the opposite. With the work that I do, the political arena really impacts us depending on what stakeholder group I'm working with. Because I work with several Medicaid waiver programs. And so with our developmental disabilities waivers, for example, they have very robust and influential advocacy groups. And so they are much more likely to work with lobbyists and legislators to impact the decisions that we're making here, versus another program. We have a traumatic brain injury waiver where their group is much smaller. Their providers are not quite so politically motivated, and but they also have a very, very good connection to our teams at the state. So they don't necessarily have to go to that route of legislators because they work much more closely, and I think they feel more heard. And so I think the overall impact of that is that when with those groups that are a lot more vocal, we've had programs that we're implementing that have ended. We were doing a new IT system implementation for medical daycare providers a few years ago. And I think it was the month before we were supposed to go live, we stopped everything because of political pushback. And so that sort of thing can happen, and we really try to get ahead of it. And a lot of that is kind of how my role developed, my job here. Because we had those experiences, we really needed to amp up our outreach and our engagement so that our providers that we work with don't feel, they feel heard, And even if we have to do things they don't want to, at least they're able to voice their concerns, and we can do as much as we can to address them.
Great. Thank you both for sharing. I think we probably have time for one more question if anyone has a question for the MDH team. Oh, Beth, let me give you the ability to unmute. Hold on one second. There you go. You should be able to unmute now.
Thanks. So I was just going to ask a question that I've heard many students over the years ask or fear about applying for Maryland Department of Health. And actually, before I start, I wanted to thank all of you all for being here today and all of your hard work. I know these last couple of years through the pandemic has not been easy being a government employee, especially at the Department of Health. So thank you all for all that you do for Maryland and for all of us. But my question, so many years, I counsel many students trying to find jobs over the years. And one thing they're always like, oh, like, you know, managing, wading through that state employment process. So what I was wanting to ask each of the alumni was, you know, do you have tips for sort of getting through that? And is there some bright spots that maybe people don't necessarily think about in terms of your own experiences in getting through that hiring process?
So I cheated and came in as a contractor and then got put in as a So my experience was a little bit different. I came in on an institutional or an interagency agreement through the University of Maryland, Baltimore, and I was an employee, a contract employee to the lab for a year before I became a permanent state employee. So that was kind of a unique situation for my grant. But I am also kind of what's called a federal PIN. So I'm a permanent state employee, but my position is federally funded. And so I think that, you know, the experience of like a long hiring period is really rough, and I can completely empathize. But I think that a bright spot is knowing that, you know, when you're able to kind of get into a position at MDH, people stay and they're really happy, and they stay for a while. So I think that that's really, really helpful.
So are you, just to clarify a little bit, are you, because yours was different than the contract positions that Sandy,
Yes.
right, okay. But are you still, would you maybe suggest that going through the contract way to start might be a good way to go?
I think it depends on what you're looking for. And I think it depends on what you're, you know, what's available at the time. Being able to convert through, I think that is the one kind of like political will piece to, you know, being able to convert from a contractual, whether it's through an interagency agreement or as a state contractual position, being able to convert to a permanent position is kind of dependent on the will of the Office of Budget being able to open up more permanent positions and being able to convert folks into permanent positions. I will also say that if you come in as a state contractual, it is a lot easier to, you know, when positions open up within your own administration, when permanent positions open up, you know, people already know you. And so you already kind of know a lot of times before a position is opening, like, you know that it's going to open up soon, because folks can kind of, you know, help you kind of point out vacancies for you to kind of get you in the door.
From a local health department perspective, I'm actually really glad that Beth, that you've asked the question, because Montgomery County government actually just significantly streamlined its hiring process on the county website. So the process will hopefully be shorter and more efficient. And they've actually added more HR staff to really fill the positions. And it is on the local government county website. So it is separate from the MDH hiring website, per Janet's note in the chat. So so hopefully, you know, it actually really wasn't too bad for me almost 6 years ago. I mean, it took like over a month from start to finish. So, but in a nutshell, for the health department actually, when we need staff, there's permanent positions, and also there's actually a number of upcoming positions that's opened up because we received grant funding from the Pandemic Infrastructure Grant to actually hire folks to maintain a population health data warehouse, as well as doing different data dashboards based on existing data reports that we have. So there's going to be some exciting upcoming opportunities. And I did want to mention that for temporary positions, Montgomery County government, specifically Health and Human Services, typically uses Athena Consulting. So Athena Consulting actually has its own website that you can go on and see the positions from there.
I can add one other note. I think everything Lior said is pretty much true to my experiences. I think one bright side that hopefully helps with all the students on the call is that for the health policy analysts that I hire on my team, a lot of the experience you have in school it's important, and it weighs a lot because we are hiring at entry level positions. And so we recognize that a lot of people are coming with not quite so much job experience in public health, but they have been focusing on their degrees up until the time they're trying to get hired. And so our interest is really in working with people to grow with them over time based on their skills and interests. And so if you don't have quite as much of that solid job experience, you still are competitive. So hopefully that gives some peace of mind.
Great. Well, we are just at about time, so I think this is a good place to wrap up. I want to thank our Maryland Department of Health partners for being such great partners, for pulling this event together in a very short amount of time, and for our alums who have been willing to come and share their experiences. We really appreciate it. And to our students who attended today and learned a little bit more about Maryland Department of Health, about job opportunities, I hope that you'll consider applying for positions in the future. So with that, I will dismiss us. Thank you, everyone. I hope you have a great rest of your Friday and a really nice weekend. Bye-bye.
Thanks, everyone.